In our interview, Dr. Ibrahim Kana, the program coordinator of the Saving 1 Million Lives program, speaks on the 2016 National Health Facilities Survey and the challenges in the nation's health sector. Dr. Ibrahim Kana, you're welcome to the program.
Thank you very much.
Well, just very quickly, the last report, quite similar to the 2016 recently released survey from this organization, really can be compared in one way or the other. But tell us exactly, what are the improvements between then and now?
Well, first of all, why we conducted the National Health Facility Survey indeed is the first time that we're doing it nationally. We had conducted previous ones, but that was subnational. We only conducted in 13 states. But since the introduction of the Saving 1 Million Lives program for result, and since we are going to be disbursing funds to the states, we needed to assess the quality of care that the primary healthcare facilities are providing in all the states of the Federation. Therefore, we expanded the survey to be a national survey. Basically, we assessed, just like we did for the previous ones, we assessed the quality of care being provided at the facility, i.e. readiness of the human resource, the knowledge of the human resources, the equipment available, availability of drugs, financial management, administrative structure, and everything you can think of around the primary healthcare facility, including the structure of the building itself. And that's what we tried to look at in the 2016 survey, which of course is a huge improvement compared to what we had in the 2013-2014 National Health Facility Survey.
What do you define as huge?
Yeah, huge. First of all, we expanded the coverage. Now, because of the introduction of the Saving 1 Million Lives program for result, we're looking at key indicators around maternal, newborn, and child health. Therefore, here we are now specific on what does a pregnant woman require in a facility. A pregnant woman going for antenatal, what is she expected to do? What is she expected to receive? One, from the human resource in the facility. Afterwards, the investigation, that is laboratory investigations. Afterwards, drugs. Afterwards, delivery. Afterwards, the baby is born. What does the baby require immediately after birth, shortly after birth, and after discharge, even after 6 weeks? Now, we're also looking at the situation whereby in our aim towards eliminating mother-to-child transmission of HIV in Nigeria, which is one of the indicators of the Saving 1 Million Lives program for result. We also expect that a woman going for antenatal must be screened for HIV. That is one of the issues, one of the things that we also measured. We also looked at the major causes of maternal and newborn in Nigeria. We assessed that directly. How did you assess that? We assessed the competence of the human resource in the facility. Are they able to diagnose or to easily pick up the early danger signs? For example, in a woman, antepartum hemorrhage, in a woman, bad asphyxia, in the baby after delivery, or children under 5 years. We look at severe diarrhea with dehydration, look at malaria with anemia, look at another major cause of mortality among children is pneumonia. Whether the human resource in the facility, in all our PHC facilities, are able to actually diagnose and treat children with malaria, with pneumonia.
That brings me to this. I mean, you mentioned that diagnostic inaccuracies is one of the major problems. So how serious is this?
Yes, the survey actually opened our eyes. One, we categorize the health workers in the facilities. Therefore, the survey made us now understand clearly that the bulk of healthcare workers at the primary healthcare centers in Nigeria are the community health extension workers. In fact, what the survey shows us is that over 70% of the healthcare workers in the PHC in Nigeria are community health extension workers. Now, by the time you aggregate that, and you now look at the clinical competence, ability to make diagnosis of these danger signs or killer diseases, you now find that Nigeria is doing very poorly. But if you disaggregate into profession, of course there are some facilities, even from the survey, where you had medical doctors. You now see that the ability of the doctors to make such diagnosis is over 60 to 70%, which is a true reflection, really, because the doctors naturally have capacity to make such diagnosis, followed by nurses and midwives, and then the community health extension workers. Now, what the survey has told us now to do is, look, Since we have this huge number of community health extension workers in the country, what should we do as a country? Should we post doctors? Do we have enough doctors to be posted to primary health care centers? In the interim, if yes, but in the interim, since we have these community health extension workers that are called CHUs and JCHUs, what we should do now is to train them more, give them more training on management of women during antenatal, delivery, and children under 5.
So it's not just facility right now, it has to do with even the professionals.
Absolutely. You know, the facility, what makes a facility are the human resource. You can build beautiful structures, you can have all the equipments. If the human resource don't have the capacity, you are not going to deliver any service. And that was why we picked that, in fact, as the #1 indicator.
So let's understand now the state of PHCs across the country, because, I mean, PHCs primarily are established to really, one of the reasons is to reduce mortality rate, you know, child mortality, or, you know, and so on and so forth. But again, the president mentioned very recently this year, as a matter of fact, that it will concentrate on PHCs, the revitalization of PHCs. So what was really your observation, you know, the true state of, you know, the PHCs across the areas you visited?
Now, the truth of the matter is that overall, our performance is suboptimal in terms of infrastructure, in terms of equipment. When we talk about equipment here, we're talking about basic equipment. Thermometers, blood pressure equipment, torchlights, and basic equipment that you require for mothers to be delivered, pregnant women to be delivered in the facility. We did not have the, we are just having about just 50 to 60% of facilities actually have that nationwide. So what it has informed us now is, even our facilities in the revitalization process, we should concentrate on providing equipment to those facilities. And that's one. Two, we looked at the availability of vaccines and vaccine commodities, i.e. the cold chains, refrigerators, and other appliances that you require in the management of vaccines in the facilities. That also, the survey showed us clearly that they are not enough. Therefore, the Mr. President's revitalization program is actually apt. That now we have data to support what the government is doing. That we are already addressing the problems even before we even had the science of the research actually brought them out. We also look at family planning. You know, whether we like it or not in the country, our fertility rate is very high in Nigeria. And if that is the case, how do we bring that under control? We are not saying women must do what they call family planning not to give birth. No, we're talking about child spacing here. Therefore, government has made concerted effort towards procuring large quantities of family planning commodities. But what we did in the survey is to tell us, are these commodities going to the facilities? Two, not just in the facilities, are they being utilized by the women? But what we have seen is that we're only procuring the commodities in Abuja. They are not getting to the facilities.
Well, Dr. Ibrahim Kana, thank you so much for your time and information on Dateline Abuja.
You're welcome. Thank you very much.
Well, thank you for your meals. As always, keep sending in your views and comments using the email address and Twitter handle on your screen. Also, be sure to share anything happening within your locality. Now, don't you forget, you can view the program on youtube.com/channelsweb/videos. Thank you for watching this week. I'm Gloria Umezuke. See you again.